Joining us now is Dr. Tom Ryan. He is with the Virginia Hospital and Healthcare Association, and the Virginia Hospital and Healthcare Association yesterday had a press conference in Richmond. I was there, where they were talking about how to get healthcare collaboration on antibiotic stewardship. And kind of the overall gist of it is that antibiotics were being overprescribed, overtaken, and as a result of that, certain people were building up resistance to antibiotics, and they were no longer working, which then causes all kinds of other problems. So it was a fascinating press conference, and I wanted to elaborate on that a little bit. So we've got Dr. Tom Ryan with us. Dr. Ryan, good to have you with us, sir.
Good morning, John. Good to be here.
Listen, I enjoyed some of your talk yesterday, and this is another one of those areas that is not on anybody's radar screen. And what was fascinating to me is when you were talking about the fact that antibiotics are overtaken, overprescribed for things that they're not going to do anything for, and there is a downside to that, right? It's just not taking, you take a medication, it doesn't really affect what your problem is. But there is a downside to it. Can you elaborate on that so our audience understands it?
Well, you're correct, John. There's a very significant downside, and what we are trying to do this week is use what we're calling Get Smart Week. It's a collaborative effort between the Medical Society of Virginia, the Virginia Department of Health, Health Quality Innovators, and the Virginia Hospital and Healthcare Association. Our goal is to try to increase the awareness, and we're very pleased that you also are helping us get this word out. When antibiotics are used either unnecessarily or when the wrong antibiotic is used, it not only doesn't help your illness, but it also can create resistance among the bacteria. And if, in fact, we go through the next week and years with bacteria that are resistant to the antibiotics, we could end up going back to the early 20th century before sulfa drugs and penicillin were invented. And infectious diseases will no longer be susceptible to these antibiotics, and it could be a very great problem for our populace. So we're trying to increase the awareness both of our prescribers, our physicians, right, nurse practitioners, PAs, and all of our populace, from moms that are bringing their children in to the doctor's offices, so that we don't set the expectation that they're going to walk out of there with an antibiotic prescription if, in fact, an antibiotic is really not right for that illness at that time.
Well, you know what's interesting, doctor, is a lot of people don't realize that if you overtake antibiotics, that there is that reaction to it, that the bacteria in your body can just build up an immunity towards the antibiotics that you take when you actually need them, right? I mean, that's kind of the bottom line to this.
Well, it is the bottom line, and it's a critical bottom line, and we just have assumed that antibiotics are always going to fix whatever ails us. And in many cases, that's true, and it's been a wonderful thing that has occurred to us since the middle of the 20th century when they were developed. But antibiotics are no longer coming out of the pipeline so quickly. And we have to understand, number one, what are the changes in the bacteria? Because the bacteria is changing every year. We need to understand the changes in the bacteria and their susceptibility to the antibiotic. We need to be able to educate our providers so that they're able to stay right up on top of what the bacteria are doing and know which antibiotics to use in which dose and for what duration.
Now, I want to run down one of the things that I asked you yesterday in the press conference was that, why would doctors prescribe an antibiotic when you don't really need it? For instance, you mentioned a couple things where you don't need an antibiotic, like a runny nose, a cold, a chest cold, bronchitis, right? Things like that. The flu, common flu. You have a sore throat, basically, except strep. You have fluid in the middle ear. And I said, well, why would doctors prescribe an antibiotic if your problem isn't bacteria related? And your answer was fascinating. You said a lot of people go to their doctor, right? They have something the matter with them, Dr. Ryan, and they expect to come out with a piece of paper and a prescription on it. And I'm like, you got to be kidding me. But then I thought about myself, and I'm like, yeah, if I go to my doctor and I, do the copay and wait online and go in there and he does it, and then he says, take 2 aspirin, go to bed, you feel cheated, right? You're right.
You're exactly right. And so one of the great needs during this Get Smart Week is to not only educate our physicians on the changing habits of bacteria, so how do we adjust our antibiotics, but we need to change the expectations of the people for whom we care. And yes, when somebody comes to a physician, or they go to an urgent care center, or they bring their children into an urgent care center or their family doctor's or pediatrician's office, their expectation is that they're going to, number one, be looked at and diagnosed, and number two, they're going to come out with medicine that's going to fix it. And what we're finding is that sometimes those expectations, and the physicians, the nurse practitioners that want to please their patients, want to serve their patients, are saying, okay, here's your amoxicillin prescription or your azithromycin prescription, and mom is happy, or whomever is being treated is happy. But we need to change those expectations, because the need is that many times, if they're viral illnesses, it is going to do absolutely no good and may, over time, cause the harm that we've already discussed.
So when you say the harm, so part of it's a dual education that you have on, Doc, right? Number one, Dr. Ryan, you've got to educate regular practitioners, general practitioners, not to overprescribe antibiotics if they're not sure that the problem is bacteria-based, right? So that's half of it.
That's
and
correct.
Then the other half. Go ahead.
We need to keep them apprised of the latest research done by the CDC in Atlanta, because the bacteria are changing all of the time, and we need to keep our practitioners apprised of those changes. That's one half of the challenge.
Okay, and Dr. Ryan, on the patient side, there's got to be an education that every time you go to the doctor and you have the flu, or you have a sore throat, or you have a cold, or you have a runny nose, you're not going to walk out of there with a piece of paper and an antibiotic prescription. Because I even know in my own family, it's so interesting you said this in yesterday's press conference. I know in my own family, Dr. Ryan, that I've been sick and I've got, the flu or something, and my own wife has said to me, oh, you need to go to the doctor and get an antibiotic. It's like, well, I don't think I need that. Oh, yes, you have to go. And then if you do that, you'll be better. They'll be like, you'll be immediately better, and you'll stop coughing. You're not going to get everybody else in the house sick. And that's just not true, right?
Well, you're right, it's not true. But patients are misled sometimes, because they go into the doctor, they get an antibiotic, and they get better. What they don't realize, it was probably a virus, and they were going to get better at that period in time anyway.
Right.
So it's the expectation needs to be changed by all of the citizens in the Commonwealth of Virginia, and toward the end of and this is an important thing, toward the end of educating our providers, these 4 organizations that I mentioned earlier on are collaborating to put together on February 1st, upcoming, an entire day of antibiotic stewardship learning, where we will bring somebody in from the CDC. We will have other expert speakers at the downtown Marriott in Richmond, and we will be talking about antibiotic stewardship for that entire day on February 1st. So people need to get on that. That precedes the 2 days of the annual Patient Safety Summit in Virginia on February 2nd and 3rd in the downtown Marriott. And our providers across the Commonwealth can get on to the VHHA website and register for those 2 programs.
Wow, now that's pretty interesting. Dr. Ryan, in your speech, in your remarks yesterday, you talked about the 3 things: having the right drug, right dosage, right duration. And, when you talk about antibiotic stewardship, but really there's a lot of medications now being, I don't know if the word would be overprescribed, overutilized, abused, if you will, whether it's opioids or something else. So, I mean, isn't this kind of ties into a pattern that we've had now in America, right?
Well, if you want to get into the philosophy of American society, I think that, yes, in American society we have been so accustomed in the past 100 years of being able to take a medication, take a pill, and it will be fixed, that we have probably done a couple of things. Number one, we have maybe relied on pills or medications to a greater extent than we should have. And number two, we have let go by the wayside some of the more natural means of helping us stay well and then helping us treat illness. So that may be a general philosophy of American society over the past decades, and it's true across other medications too. The challenge with antibiotics, and the reason that our four organizations are working so hard to increase the awareness about antibiotics, is if in fact these bacteria become so adept at dealing with our antibiotics that they become resistant, we end up with, in the future, having one of the great scourges to human health by having infectious disease all over again with no antibiotics to treat it.
Right, because people have taken antibiotics when they didn't need them, and so then the bacteria that they're designed to knock out then develop immunities to the antibiotic, and so the wheels come off, and the infections or whatever you have, the bacteria persist on unabated, right? That's what happens.
You've got it. That's absolutely the essence of the challenge.
All right. Well, I want to thank Dr. Tom Ryan for his time. Dr. Tom Ryan, the Virginia Hospital and Healthcare Association Senior Medical Advisor on antibiotic stewardship. And look, the final message is, if you have a cold, if you got the flu, don't run to your doctor looking for an antibiotic, because it isn't going to help you. And actually, there's a huge downside, right? It's not like taking an aspirin and you don't really have a headache. It's just there's a big downside. So we've all got to be educated on this and be careful. And every time we go to the doctor's office, we don't have to come out with a piece of paper to take to your local pharmacist. Sometimes, like, my doctor, Muscle Manny, sometimes I go in there and he says, you have to lose weight and take 2 aspirin and get some sleep. You shouldn't feel cheated by that, right? That's the bottom line.
You're exactly right, John, and I want to thank you and your radio station for helping increase the awareness of the citizens in Virginia.
All right, and I want to thank Dr. Tom Ryan. And every time I go to my doctor, Dr. Ryan, and I get on the scale, he just looks at it and shakes his head. That probably isn't a good sign, right there. Thanks, Dr. Ryan. Thank you so much.